Hello, I'm Lauren Bolding, and I'm a board-certified prosthodontist and board member of the Foundation for Facial Recovery. I would like to share with you some information regarding conservative treatment for temporomandibular joint disorders. Generally, to conservatively treat many temporomandibular joint disorders, I'll fabricate a stabilization-type appliance. This is a full coverage appliance worn on one arch, made out of a dense resin material to different degrees of thickness based on patient needs. Models of the patient's teeth are made and mounted on a device called an articulator. This gives us the upper and lower jaw relationships. In the lab, the appliance is built in wax to a certain thickness and then made into this dense material, forming the final product. While different patients have different needs, there are multiple appliances that can be used to treat temporomandibular joint disorders. However, in our practice, this is the most common and works very well for most patients. This oral appliance has many purposes. First, it protects the teeth from further damage from parafunctional habits like clenching and grinding. It does not stop someone from clenching and grinding, but instead of putting these forces directly onto the teeth, the appliance becomes the barrier there. For most people, the majority of the clenching and grinding occurs during sleep, so this is the most important time to wear the appliance. Of course, everyone is different, and some people will benefit from daytime use of an appliance as well. Next, I adjust it so that the occlusal or biting contacts are spread out along all of the posterior or back teeth so that the muscles are stabilized and do not need to work any harder in order to get even, stable contacts. This allows those jaw closing muscles to be able to relax some, easing tightness and tenderness over time. In those situations where an uneven bite is a big contributor to clenching and grinding, this appliance will help to lessen those parafunctions. In addition to protecting the teeth and muscles, it also protects the temporomandibular joints and the joint space. When the teeth are closed fully, without something in between them, the condyles can potentially be pressed into the socket in which they sit, causing bone degeneration of both parts of the joint. Arthritic joints can be worsened by these pressures, but on the other hand, young, healthy joints can also be damaged by these excessive pressures. Between those two bones also sits a capsule, which houses the disc that should easily glide with the condyle as it moves in opening and closing. Clenching and grinding can put pressure on this capsule and disc and cause it to become destabilized and distorted, which can often lead to joint noises, pain, jaw locking, restricted opening, and a variation of other symptoms. If an oral appliance with an adequately constructed thickness is worn, this space is protected, is not compressed during clenching and grinding, and the disc can often get back into position and restabilize, leading to a decrease in symptoms. No one particularly wants to start wearing an appliance every night, but if it means conservative treatment for a disorder that can be extremely painful, debilitating, and consuming, it is a well-accepted treatment by most patients and is very effective. It is very important to be evaluated for temporomandibular joint disorders sooner than later if you are experiencing any symptoms like frequent headaches, facial or jaw pain, facial muscle fatigue, or if a dental or medical professional has recommended you see someone due to any other signs or symptoms they have noted. Thank you so much for taking the time to explore this treatment option with me. And if you would like some more information, please visit greaterdcspecialists.com or the Foundation's website at foundationforfacialrecovery.org.